Hi, good afternoon. My name is Yufeng. I am an associate professor in chemical engineering. Thank you for inviting me to give this kind of presentation to introduce our lab's research. So, undergrads, if you are interested in our lab's research, feel free to reach me out via email. I also have my lab's website at the end of the slide, so feel free to just check our existing publication and research out. So, first thing, I would like to thank all my private students and current students who made a lot of great efforts in our lab's research progress. So you may see that current students in this lab include two undergraduate researchers, Jada and Connor. They are both doing great jobs. Jada is more focusing on the pulmonary healthcare. Connor works on modeling some kind of chemical engineering processes, and those kind of experiments are included in our unit operation lab. So you will have the lab in your junior and senior year. So Jada got the freshman research scholarship as well as Wen's research scholarship. Connor got the freshman research scholarship, and now this is his second year, got the seat and the graduate research scholarships. So what we are doing in this lab, so we use computational fluid dynamics to do different applications, but majorly we focus on the long airway. As you may see in the left animation, there's like airflow, there's some other gases and some other particles that we can predict it. So they can be therapeutic or they can be toxic. To the right, you may see the long airway is expanding, contracting. That's kind of the advanced model. We are trying to capture the lung deformation, especially thinking about if people have lung diseases, their breathing capability is different from healthy people, how we can use this first principle based model to capture that effect. What we care about is mostly the question I listed above. So what size of what type of particles deposit where at what surface concentration in the human respiratory system? Why this is important? So when you think about the particles in the long airway, so if they are therapeutic like drugs, will they be effective to treat some lung diseases, or they are just let's say overdose, or let's say the dose is not high enough to kick in the kind of treatment effect? That's a question, and that need our understanding about how those aerosol transport and deposit in the long airway. But as you may see in this slides, there's also something else which is called toxicokinetics. So when you think about lung deposition, is something that we can predict it using the computational fluid dynamics. That's not those particles end fate, right? It's not their final destination. They will go into the blood circulation and then goes into different tissue groups. Let's say if this is e-cigarette, or this is cannabis, or this is like welding fume, like those iron particles. When it goes into the blood circulation, it can cause some troubles, right? So after we know the particle deposition, we also connect our CFD model with physiologically based toxicokinetics model. So those kinetics model can can predict the kind of translocation of those chemicals and predict their concentration in different tissue groups. Like what, as an example, you can see the plasma concentration. So the plasma concentration and other concentration over time that can give clinical doctors or regulatory science people very good indication about whether that can cause some safety problem or that can cause some kind of ineffective treatment effect. Those are important. But we recent years, we also integrate CFD and machine learning. So we are trying to utilize the two advantages from CFD and machine learning, deep learning separately. CFD can generate a lot of detailed high resolution data. Like the spatial temporal distribution of any variables of your interest. It can be velocity, it can be pressure, it can be temperature, it can be concentration. But the computational time is very long. Deep learning or machine learning, they are able to learn something from large sets of data. And when they are trained very well, they can be used as a fast-running and reliable models to predict something. So one of the examples we try to integrate CFD and AI together is like we try to use the CFD simulation about the airflow velocity in human lung airways for 990 cases, different lung obstruction conditions, and we use those airflow velocity distribution in the middle of the chest as the training data, labeled bed obstruction locations. Use them to train the machine learning model. Actually, it's a deep learning model. And then what the deep learning model can do is when they receive a new chest air velocity distribution, they are able to tell where is the airway obstruction. So this is something we tried, and there's a publication about this. Also, another thing that in this lab is like we create a lot of different what we call the virtual human system. So they can be used to put into different indoor environments and outdoor environments to learn the occupational exposure risk. So if there is some toxicant in the aerosols, or there is some infectious disease virus in the aerosols, and this can be transmitted via their airborne behavior, then we can use this kind of virtual human to predict this kind of infection risk index, or maybe it's the occupational risk index. So as the PI of this lab, I always think that research should be divided into two different categories. One, as a lab or as a research program, we need to contribute to some fundamental level that create a new model, create a more advanced model, or we can just use some of the existing models to do some new applications. So I listed something here, and I would like to show a couple of good examples. So one of the examples you may already see a little bit is about this, what we call the moving long or the elastic long model. The reason is the same. So we want to capture how the patients with some lung disease, they may lose some of their breathing capabilities, and when we want to deliver the drug through their airway, can they inhale the aerosols in the proper way, and can the aerosols go where they need to go? So we cannot use healthy people's lung condition to predict this patient-specific or disease-specific effect. So this is why we create this dynamic mesh model, which can recapture this kind of disease-specific lung behavior. Also, you may see something else, like this is a nasal cavity, and you may see some nasal hairs in the front, right? So before this study, most of the people using the nasal cavity to simulate how people inhale different type of particles and to predict what kind of particles and what is the concentration can goes into the airway. However, that is not the real world situation. So our nasal hair behaved like a filter. So without the nasal hair, the prediction can be totally misleading. So that's the motivation that to say, okay, my lab just say, let's do this. Just run those simulations to model the nasal hair as flexible fibers. As you may see, those fibers definitely behave like a filter. So I always just tell the jokes to my lab saying that, okay, after you guys run this simulation, I probably won't treat my nasal hairs anymore. But again, that's just a joke. It's not good. We also have some other applications. So when we think about the capability of simulate the particle transport, particle interaction, and also together with airflow or blood flow, this is definitely something we can apply to some inhalation therapy or inhaler design. FDA fund this research on the screen. So they want us to build a reliable model to predict the emitted particle site distribution coming out from the dry powder inhaler, predict the induced lung deposition, and then predict the systemic translocation into the blood circulation and other organs. So this can provide them a quick running. I would say it's either quick running like the machine learning model, or it is more first principle based model which provide high resolution results or prediction to the regulatory science, so they can evaluate if there's a new inhaler or there's a generic inhaler design. They can evaluate what kind of performance those kind of designs can give us. Another just a recent research is that we also try to model and optimize the atomization process inside of a soft mist inhaler. So for soft mist inhaler, they have two jets, and they collide, liquid jets collide each other, and they started to do the aerosolization. So one of my recent graduate PhD students, he modeled the atomization process by using this fancy model. So he changed the surface tension of the liquid, he changed the viscosity of the liquid and the jet velocity, and try to see how different factors can influence this atomization efficiency. We definitely, like I said, we use this kind of virtual human model to do the exposure risk assessment, and just want to show you kind of the workflow that we are doing. But also, talking about applications, I'm a professor in chemical engineering, so I would like to apply the computational fluid dynamics into kind of a prediction of different chemical engineering processes, right? What you can see here, this is one of our labs, one of our unit operation labs, packed bag reactor. So Connor and I built this 3D packed bag reactor digital twin, and we run different flow rates, we run different temperature, and see how the hydrolysis of methyl acetate can be influenced by this kind of factors. But also, I have the plan to say just we create digital twins for all the experiments in the unit operation. My motivation about this is like the students can collect some data from those real world experiments, but as you may see, if they really want to learn for this example, if they want to know how the reactant spatial distribution and the product spatial distribution inside of this packed reactor, they cannot collect that in these experiments, but they can run this in simulation. By having these two different tools, they can understand this experiment much better, because they have more data. They should be able to gain more insights. This is one example, and another example is an industry project supported by OCAST. So we help a local company to model their commercial scale distillation tower or distillation column. What we want to do, what we already done is we predict the vapor concentration and vapor velocity distribution inside of this kind of column. What the industry cared about is how even the distribution of the velocity and concentration will be when they reach the supporting structure. On top of this supporting structure, they have packed beds. The more even, the better. So we changed the column diameter, we changed the vapor returning inlet diameter, we changed the vapor returning flow rate, and changed the manhole locations sometimes. So this, we will generate a lot of data, and using those kind of CFD simulations is non-invasive, is cost-effective. The industry can use that to guide their optimization of their distillation tower design. Okay, so those are all our simulation results and research directions. I would say my lab definitely like to do CFD. Mostly it's about healthcare, but I'm definitely having the plan to run more simulations, build more CFD-based digital twins for different chemical engineering processes. If you are interested, feel free to email me, or if you want to learn more, you can definitely visit our lab's website. Thank you so much.